Welcome to the Heart of Healthcare podcast. Nate, welcome to the show.
Hi, Halle.
All right. So for listeners out there, just a quick background. Nate and I met at HBS many years ago as business school students, and you were also working on your MD. We worked on Rock Health together as an independent study with Professor Bob Higgins. Meanwhile, you were also starting Doximity along with Jeff Tagney. And after school, you spent 15 years as a co-founder and chief strategy officer of Doximity, which you helped take public. You were also heavily involved in Rock Health as a board member and still are today. And then last summer, you called me. I remember this call because I was in the Berkshires. I was like taking a walk around a lake, and you told me you were leaving to join OpenAI. And for those of us who know you, it wasn't really a surprise. You've always been quite technical and on the forefront of innovation. But most people, after a career like yours, starting and taking a company public, retire or go into VC. So maybe you can tell us about your new role at OpenAI and how you ended up there.
Sure, and thank you for the kind background.
Did I miss anything?
In short, I don't think so. It's a nice way to describe way too much grad school and then going into startups. But, in short, it was due to the mission, and the mission was really real. But you're right. This is a full circle conversation for us, and it's pretty fun. I think the thread between everything has been, a lot of my career has been the same question from different angles. It's just, how do we make healthcare work better for the people living inside that? When I wasn't with you in Boston, I remember spending a lot of time at Grady Hospital in Atlanta. And I mean, we were doing that schooling when there were still paper charts. The iPhone came out, the newsfeed came out, the App Store came out, WhatsApp came out, Twitter came out. Like the whole modern consumer internet was exploding around us. And yet, we did some digitization in healthcare, and that was popular. But of course, it missed the potential that was represented by everything that was sitting in our patients' pockets. So Doximity was a great, practical view into, how will doctors actually use tools? What actually works? What makes their day harder? What introduces friction? And to combine that with the opportunity to spend time with you working on the Rock Health concept and looking across that whole ecosystem, patients and entrepreneurs, systems, payers, employers, all of that. That was a better front row seat than anyone could have ever asked for. And it, I think, came with this responsibility to stick with it and see some of these things through. And it also, I think, made the OpenAI mission resonate a lot with me, which is make sure AI benefits all of humanity directly and indirectly through the work that it's doing in healthcare. And I think once you start working on that in health, everything starts to become concrete really quickly.
Yeah. When I think of the big AI players, OpenAI, Anthropic, Gemini, and we'll also give a shout out to your brother who works on healthcare AI at Microsoft, I like to visualize a horse race. I see one in the lead, and then there's another announcement, a new release, and then the other one gets a little ahead, and so on and so on. And it's really crazy how much technical progress is happening in very short amounts of time. What do you think ultimately determines who wins, if anyone does?
It's a good question. I don't know if we want to necessarily approach it as a zero-sum sort of a framework here. I think it's wonderful to have lots of people building in the space and, challenging our assumptions and keeping us moving fast. So I'd reframe the question slightly. It's probably not going to be one company capturing the whole category. If one company captures 20% of GDP, as you see in every deck that pitches you, then good for them. That's a lot to bite off. It's too large. It's too fragmented, and it's really too workflow specific. So I think it's going to be more like who helps the systems win. And when I say systems, I would actually extend that. I mean, patients need to be more informed and prepared. Clinicians need capacity. Health systems themselves need to reduce friction and not create new risk through all these tools. Scientists need to move faster. Those are all really different jobs. And so I think that the companies that are going to matter are going to do a few things well. They're going to solve those workflows that need to be solved. And, we mentioned a lot of the language and the synthesis and the coordination that needs to happen there. They're going to earn trust, and you have to earn trust in a different way and really earn it for each one of these stakeholders. And then you have to come up with like a model that makes things broad enough to actually have impact and not just be interesting and connect into the ecosystem who are actually delivering care today. And so, of course, we're doing some work there with ChatGPT Health and ChatGPT for healthcare and clinicians and now GPT-Rosalind. But I think a lot of this is also going to be like those are just our products. And we look at it from our models, our products, and our partnerships. And I think each one of those is a lever to pull. And the models empowering our thousands of ecosystem partners who are using GPT-5 and to start doing things more effectively for the missions that they care about. It's really similar to our Rock Health mission in many sorts of ways. It's like, let's take people that have an idea and are blocked by some friction and empower them a bit, give it tools to cut through that, to bulldoze through that.
But I would argue that at Rock Health, we supported companies, but we never started our own companies. There was never anything incubated. And OpenAI is doing both, right? Like you guys are both supporting companies. You have tons of ecosystem partners, startups that are using OpenAI to deliver their services, but you also have become more than just a platform. You have these products that you've talked about.
Well, I'm glad at Rock Health we didn't try to build our own companies. I know you had enough to do managing it day to day. But that said, I do think that we have been fortunate enough through shaping in many ways this most recent beginning of the AI, modern consumer AI revolution through the launch of ChatGPT, that we've gotten a lot of engagement on the platform. And before we even had ChatGPT Health, we were already, we realized, quickly becoming the world's biggest health app. The numbers are 900 million people use ChatGPT every week. And if you look at how many of those are doing health queries, it's about 230 million, like 1 in 4-ish. It's like 40 million people a day. And so that is a responsibility to build healthcare apps. They're going to use that no matter what. And that translates into the professional setting as well. We go to these hospitals and these other ecosystem players and they check their IP logs and they're using ChatGPT throughout the day.
I've talked to the hospital admins about this. They're very concerned about use kind of beyond what they've approved.
Yeah, and so that is an opportunity to really dig into those workflows, but it's also a responsibility to make sure that we're doing the things to get it right.
Yeah. So I'd like to get into how each part of the healthcare system is using AI, from patients, providers, and now pharma, and also how you're thinking about guardrails. But let's start with patients and ChatGPT Health. So as you said, 230 million people asking health-related questions every single week. What are you doing to ensure that the answers they are getting are safe and accurate?
Yeah. Well, I think in order to answer that question, we have to talk more about what are they doing so that we can meet them where they are. As we said, patients are pulling this out throughout the day. I don't think the answer is to take an ostrich strategy and pretend like it doesn't exist. And you see that in other areas of healthcare, like the secure messaging space. So I think job one for us is triage and translation. We see a lot of queries around what does this mean? Or what is this thing I'm feeling? What is this lab I received? What is this word that the doctor said? It's the kind of stuff that would be a Google search in the past, but that Google search had amnesia and it didn't know if they were 20 or 70 or have any of their personal context. And so how do we explain what that means? How do we understand what is urgent and escalate appropriately? And how do we empower the patient or the consumer to take next steps, which very well might be asking their clinicians things. I think another one is preparing for scarce human time. So you mentioned just a minute ago whether or not there's a friction role here with the existing healthcare system. And I think the friction that has existed in the past is a mixture of the healthy skepticism and uncertainty that should always exist in medicine. That's part of the job. But then also just scarce human time. You look at the previous tech waves and it's not like the doctor had time or technical capability to process 300 pages of Fitbit data, and there certainly wasn't time to translate a 20-page deep research report. And so the answer there is not to shut the patient down at all. The answer is to figure out how do you use those other 364 days where the patient is doing this this meaningful work because they care about their health, and translate that into what can they do in their 7-minute visit that they finally get to have with the healthcare system that can be empowered pre or post-visit. So pre-visit, that's things like you have too many things you want to talk about, too few things you want to talk about, and maybe you should be nudged to talk about something that's important. Post-visit, I mean, what was that big word that the doctor said that was in Latin? Like we speak a moon language in healthcare. Or, how do I take that low sodium diet or that 8.5 by 11, generic handout and translate that into my own dietary preferences and my vacation plans and my hobbies. I think if we do this right, it actually leads to a lot of adherence to care, because the adherence to the doctor's care plan comes from better understanding and being able to better take advantage of the limited time that you have during these moments. And then finally, and this is an important one, but it's the handoff for the high-risk situations. And it's making sure, and happy to go into this if folks are curious, of what we're doing in the actual model training to make sure that, the chest pain with red flags and the stroke signs and the severe bleeding and all of that hits the right escalation path and not a clever long chat.
Yeah. Yeah, I do want to get into that. I do want to just say one stat that I read from your most recent report, which is that 70% of these conversations are happening outside of normal clinic hours. Also, something that has to be said is that it's free or at least low cost. So while you said this is ultimately competing with Dr. Google, which, it is. It feels like a preferable way to get information, especially personalized information, than landing on, a company's really good SEO optimized website trying to sell you a peptide to solve your problem. But really, it's also competing with the healthcare system, or at least it's a symptom of the healthcare system that we have created, which gives us very little time. And as you said, the information is in the moon language. I love that. So I would say that those are kind of some things that I think help us understand how we kind of got here today, and knowing that having this information is something that obviously patients want. But two of the biggest critiques of AI in healthcare that you know very well, one is that it's always your yes man. And the term, I love this term, I didn't know this term before 2 years ago, but that it's sycophantic, meaning it tells users what they want to hear. And the second critique is that it hallucinates, that it just sometimes makes stuff up. So maybe you can talk about how you're working to train, or how maybe you have already worked to train models to not be like that.
Sure. Well, the ChatGPT revolution was just a couple years ago. And so I think one of the biggest challenges that we have in medicine as a whole is figuring out how do we measure, but also then how do we communicate and standardize what good looks like. And this doesn't necessarily move at the speed that the previous generation of strategies that were able to keep up with. So a good example is like the publication industry. If it takes 18 months to study, even after you study something, to get a paper out, like it's going to be, I see papers come out on GPT 3.5, and it's like, how do we have a real-time conversation about this? But if you trace all of this back to the underlying goals, it's how do we know what good is? And I think we see that question if it's a doctor asking it, if it's someone leading the health system asking it, but we ask it a lot internally. And we have many different model training mechanisms here, but I think that the one that's worth calling out the most is our evaluation work, which is led by our more public health bench efforts. And so this is what a good health answer looks like according to actual physicians. And that might sound obvious, but it's actually a pretty big shift. Like it's not what you see in the press releases that say, oh, the model scored a 97% on the USMLE exam, or like it's not using an exam that was probably mixed in the training data or something as the actual benchmark here. And more importantly, it's tremendously respectful of the fact that like patient care is not a multiple choice exam. Real health conversations are messy. And a lot of these simulated exam questions have like the cherry-picked amount of information pulled out to answer the question. But real conversations are missing information that you need to follow up on, or there's a totally unique set of comorbidities or social determinants of health and real-life feasibility that's mixed in, and the patient might be scared and the clinician might be busy. And so we have to address all of that. And so what Health Bench does is help us figure out, when should we ask for missing context? When do we express uncertainty? How do we design around realities? So we worked with hundreds of physicians to create essentially thousands of actual clinical scenarios. And then we gave them rubric criteria. So as an AI, you could participate in these clinical scenarios as a patient or as a doctor or other professional, whatever that scenario was measuring, and you would earn points and lose points. So like, sure, you earn points if you get the diagnosis right. But if you look at the reasoning and it didn't go through that 1 in a million situation, that could have had a bad outcome, or it didn't appropriately look at social determinants of health, or whatever doctors have decided that they would want to juggle in their head in a perfect world, if they could have time to explore everything, they might lose 10 points if they didn't do those things. And so that allows us, instead of just to go after diagnosis right, we can say, did the model escalate to emergency care right away when it's appropriate? Or did it adapt to the appropriate literacy of the user, whether that's an oncologist or a primary care doctor, someone at the 12th grade reading level, someone at the 3rd grade reading level? We can score all that accordingly. And then finally, and this is a huge difference from what you saw in those earlier versions of the models that you referenced, expressing uncertainty. A year and a half ago, the models were a little bit more like an overconfident intern in some ways, right? Like if it hallucinated, or even if that was 1 in 1,000 times, that might be just as confident as the ones that were factual and accurate. And so now we can measure, when the model should be expressing uncertainty, when it should be asking follow-up questions, which is a huge part of interacting with patients and consumers, because you don't get all of the information up front in the prompt.
Yeah.
And that allows us then to go chase those areas down and do the subsequent training. Like you talked about this in your book a little bit on the, don't build confidence, build evidence side of things. And like you have to do that in a way that reflects these messy conditions if you want to matter.
Can you give me an example of like a conversation someone would have around their health with a chatbot that 3 years ago versus like today? Like, what's like a concrete example of how far we've come in asking health questions?
So I think one of the examples that I'm increasingly seeing is the way that folks can use it as a chief of staff when they're managing a really tough condition. So say a cancer diagnosis. They may want to understand the trade-offs in their care that might be between radiology and chemotherapy and surgical approaches. And that's not to conflict with what their doctors are saying. It's to take advantage of more time than they were afforded in that individual visit, and make sure that they feel like they're empowered when they have those next step navigational decisions. But then they also might want to stay up to date on what is the latest, what clinical trials do exist, what can they search for, where, to your point, if they did that on a search engine, they would quickly end up on the bad side of Las Vegas with the banner ads everywhere. And then third, there's a lot to this on how do you communicate with your family? How do you deal with insurance? How do you deal with work? How do you deal with managing things at home? How can you have a weekly conversation with a task-based agent that can ask you to summarize how you're feeling, create essentially an interactive diary that may have useful information to stay organized for your next visit? How can you dump all of your thoughts after 15 different specialist visits into one centralized repository? This is the kind of thing that, like, in the past only existed with sort of these, like, often having a spouse present or something who was able to attend every visit and have a clipboard and keep you on task about
Patient
picking up
advocate,
that prescription.
someone,
And you can recreate a lot of that, and that requires a lot of inference, a lot of organization, some agentic tasks, and none of that was possible a year ago, and today is proving to be a huge unlock.
Yeah, what if so let's think about like the early models. What sort of information would it have given you then compared to today?
It would be less context relevant to the user. So it might be closer to a one-size-fits-all approach.
Okay.
It might also
So more like a WebMD answer.
Yeah.
Okay.
It might also answer more specifically. So these models are often used to, in machine functions where you want a particular output every single time. And so, if the model had been over-designed for that function, then it might not ask as many follow-up questions as it needed to in the past. And then finally, it wouldn't have had all of the thousands of hours of physicians making sure that we're looking into every edge case and getting all the additional training data feedback loops that need to occur. And then last, it's the pairing with the extra tools like the retrieval, the ability to go look at the latest guidelines or pull in external information that, you had the early architectures for those things a year ago, but they're much more proficient today.
And they never gave like sources. It was never like, here's the source to what I'm saying.
Exactly.
So mental health seems to be one of the most notable fast-growing use cases for AI. A recent Gallup poll found that nearly a quarter of American adults have used AI for mental health and emotional concerns. Where do you see the role of AI in mental health?
Yeah, I think we should be careful, serious, empathetic. I mean, this is a story of support, not substitution. People come to ChatGPT in emotionally vulnerable moments, and some of those moments are mental health questions, and there is a spectrum to that. It could just be that your boss is annoying at work. It could be dealing with uncertainty about a decision you have to make, or it could be loneliness or grief or relationship fear, just needing to process something. And that can start to occur multimodal as people now have real-time voice ability to chat and things. And so the goal here is we're not replacing mental health professionals. We're absolutely not replacing real-world relationships.
Some people are trying to.
Some people do, and people use tools in different ways here. But the goal is for ChatGPT to respond supportively, safely, and actually increasingly make sure that we're doing our best to keep people anchored and steered to real-world support. So what does that mean practically? You have to do this same type of model training that we talked about, but instead of looking at stroke signs, you're looking for signs of distress, deciding whether de-escalation or escalation or avoidance of harmful content is the next path, avoiding encouraging unhealthy dependence.
Yeah.
Expanding access to crisis hotlines, adding break reminders if you've been talking for a really long time. And so we've put together expert advisory boards for this, but making sure that the model does the right thing with tone, escalation, avoiding over-reliance. Like it's our view that these systems should be supportive, but should not pull people away from the real world.
But there could be use for helping solve some of the loneliness issues, or would you say like you don't want to touch that?
I think that there are loneliness challenges globally that potentially are only going to get worse. And I think AI is going to have an interesting role to play there. I mean, in many ways, AI has actually helped me become a much better communicator. Now, you may disagree because you know how bad I am at my inbox sometimes. But
It takes you so long to get back to a text.
being able to, increasingly use an agent to recognize, oh, I do need to follow up with someone. Oh, here is the friction to get over that initial part of starting that note, initiating that conversation, reaching out to the person that you haven't reached out to in a long time. There's often friction blockers, and this matters whether you're making a medical appointment, whether you're going to talk about something awkward. Like that doesn't mean that virtual is the answer. It just means that AI can help with the friction steps to get people back into these human situations too.
Yep. So, okay, we talked about patients and the use of AI for many use cases. Let's shift and talk about OpenAI's work for providers. So OpenAI for healthcare is used by dozens of leading U.S. hospital systems. You guys have partnered with UCSF, Boston Children's, Stanford Children's to support both clinical and non-clinical workflows. And you just launched ChatGPT for clinicians. So tell us about this move. And specifically, I want to know if you're going to focus on clinical decision support or if you think you'll do some of the back-end admin stuff too.
So ChatGPT for clinicians is new. We're excited to launch it. It's built on top of our existing OpenAI for healthcare, which is our set of secure AI products for healthcare organizations. And as you said, we already had built versions of ChatGPT and some of our tools for the enterprise. And when you're doing it for an enterprise, you need the obvious stuff. You need control, and that's like access control, user control, data control, user management, all those things. Auditability, integration. And I mean, integration has not been historically great in AI. That's something that I think is at the frontier now. Like, how do you not just have an app store, but a useful app store, something that actually hooks into the systems that people need, which are very different in versions of or verticals like healthcare. How do you support the data rights correctly in something like that? And so ChatGPT for healthcare did a lot of those things. It gave clinicians, but also like business teams, administrators, folks charting the operating rooms, researchers, students, like it gave them all a secure workspace. Looks and feels like ChatGPT. I mean, we talked about those 900 million people a week and how everyone is using ChatGPT at work. That gave them something they were already familiar with. Like imagine having to switch at work from iPhone to Android or Windows to Mac or, whatever you're comfortable and uncomfortable with. This, if you want to empower your workforce, it helps to give them tools that they already know how to use. And this did this in a secure way. But then it also added that really important context. So you need to have the work with the systems so that you can go from natural language into relevant data, relevant policy. You need to be able to have evidence retrieval. Like the last thing you want to be doing is pulling up one of those patient websites or a forum or something like that when someone is asking a clinical question. And then you need repeatable workflows. And so this one is huge. I mean, we had GPTs in the past, but now skills is a tremendous unlock. Like you don't have an equal distribution of best practices. And if you're working in a busy setting, it's hard to remember your own best practices. Like why should you have to reinvent the perfect prompt for prior auth or patient education or staffing or whatever every single time? Like let your best people build those prompts and then recycle them. And so we were able to deploy this tech to go after, those governance challenges. But then a big part of the mission here, like I said, is making sure everyone can use this. And so ChatGPT for clinicians takes all of those features, minus some of the enterprise management overhead, and making sure that they're available to physicians and pharmacists and PAs and NPs and that sort of thing. Because docs shouldn't have to wait for that enterprise contract to be able to do things. And so now individual clinicians can do the same thing. They can use it to save time, or they can use it to read more slowly and learn more and get their CME credit. And they can do all of these, you mentioned non-clinical workflows. That's a huge part of this. I mean, so much of the job day to day is processing that Excel spreadsheet or writing those 50 letters. There's clinical support in the sense that it's clinical reasoning support.
Yeah.
AI is a tool to improve their clinical lookups, but it's so much more than that when you look at the daily patterns.
Yeah. I mean, I get so many pitches that are like the chat GPT for this specific use case within a hospital. And generally my response is like, well, why isn't that just chat GPT? And now it really is. I mean, there are a lot of workflows that you guys are now covering. It's kind of a use it how you need it at kind of the higher level can set these things. So what does that mean for startups that are still trying to sell into the hospital? Where should they focus where there's still going to be opportunity?
Well, I do think it's wonderful that there are startups going after the problems that they care about. A line in your book, innovation moves at the speed of trust. And I think that applies here. And there are people who understand the trust that's required, understand all of the hoops that you have to jump through to earn that trust. And our job is to empower them with AI. And so I think we have really symbiotic, healthy relationships with a lot of these companies. Many of the AI scribes run on our Rails. And that's a great feedback loop because they can tell us that, hey, you really need to improve, your notes in this other country because they're too long. They're used to American notes with all of the insurance stuff in. Or, hey, you could do better at this dialect or this accent or this disease or whatever. And now we can make that better for them, make that more successful. So I do think there's going to be a lot of ecosystem empowerment here. Where we typically see swaps take place is not at the level of the startups, sure for some, but it's more when people have been directly trying to recreate ChatGPT. So usually that's like an internal chat service that's like named after the enterprise's mascot that can, do some question response things well. But like that's a really hard product to keep up with the multiple updates a week that ChatGPT is getting. And so that's, our responsibility to make sure that these better models, exist that can be served through chat, which we've done now. But when we partner with organizations around these changes, it's not like they stop working on AI. It's that they focus more on the edge of these integrations. So how can we now apply, this hospital's engineering talent towards building the best EHR integration possible, or the connection into many of their other systems? And then the hospital benefits because so many of their users are comfortable using ChatGPT that adoption and empowerment and downstream
Yeah.
ROI
Plus,
occurs more
I mean,
quickly.
everybody's sick of having to log into a dozen different systems to get their work done. So that also helps. So I do want to touch upon kind of the last stakeholder that you guys are really investing in, and that is pharma. So you recently launched frontier reasoning model GPT-Rosalind for scientists, and you have some really impressive early users like Amgen, Moderna, the Allen Institute. Tell us about your team's vision here and if it's changing how research gets done, if it's speeding up existing workflows, exactly what is the purpose of this product?
So, the goal setting that we do internally has compass headings. There's the raise the floor, sweep the floor, raise the ceiling. So I think the raise the floor related work is the most similar to our overarching mission: universalize access to everything. So there's a patient flow through there, right? Help people understand their health information, prepare for care, navigate the system. There's a ChatGPT for clinicians, access to the latest models flow through there. And then there's direct and indirect, make sure that the benefits of AI and the direct access accrue to everyone. Sweep the floor, I think, is this classic healthcare story. It's just like help people reclaim time, essentially. I always go back to time, but it's, there's so much repetitive work. And so this is your documentation, chart review, like all the low-hanging fruit that exists in AI today. But raise the ceiling means accelerate what humanity can do, accelerate progress in a field, bring benefits to market far faster than they otherwise would have been discovered. And I think GPT-Rosalind fits a little bit more in that bucket. Help scientists work faster, help scientists reason better, so that the things that the scientists wanted to do in the first place can be discovered, invented, unearthed far faster than they ever would have done. I mean, you know how long, like a decade and a half now to go from target discovery to approval for a new therapy. And like, that's at every step of the way, from biology to translation to all of the bureaucracy at the end. And there's no like AI as a panacea here. It's just an opportunity. I think there's a lot of parallels to ChatGPT for clinicians. Like, there are a lot of time-intensive, complex steps that researchers have to do that we can speed up. And so it's still a large language model. It's been adapted for life sciences research with specialized training and post-training to improve biological reasoning and tool use, performance, like all of the stuff that would help you do your job better as a researcher. And sometimes that is like literature synthesis, database search, the same stuff that we do for doctors. But other times now we have the ability to go much deeper on interpreting omics or, doing target validation or like running ops for a clinical trial. So it's a tool using scientific assistant in a model. And we have some great early partners. It's obviously, like many of our tools, still in alpha. We have a lot of work to do. But I think if we get this right and we pair it with like all of the computation unlocks that are occurring right here, it could be one of the greatest accelerants to things that, when they actually benefit patients, won't feel like AI. It'll still feel like all the things that come from scientific discovery, but AI will have played a role in helping the scientist heroes do their work and fulfill their own missions more quickly.
Yeah. Awesome. Okay, so we have just a few more minutes left. I want to go into a lightning round. So if you can just keep these answers succinct and we will move through them and then I will let you go on with your day. All right. What is your favorite way you personally use AI in your day-to-day life?
I make art at home that paints itself. So every time I walk out of my living room, there's different paintings on the wall, and it has decided what it's going to display on the wall for the day. There have only been a few awkward paintings. I didn't actually look as I went out the door today, but yesterday it was like a carrot floating in space that kind of looked like Jupiter, which was interesting. So what I liked about that was it gave me an opportunity to be a builder again. And I think everyone should be looking for opportunities to try codecs and try like making their own apps. It's easier than ever before, and that's a fun way to do it.
Yep. Okay, what's something about working at OpenAI that surprised you?
I hate to say the AI use, but because of course, like an AI native company will be AI use, and people don't just talk about it, they use it. But
you're surprised.
Oh my gosh, I thought I was efficient last year, and I'm 5 times more efficient than I was this year. And now that's countered by the amount of work to do, but
yeah.
It's just phenomenal to be around people who are creatively figuring out ways to empower themselves every day through this technology.
And you're expected to spend time on that. I feel like I want more time just to like get up to speed because I know I'm underusing it. I just don't have time. Which is ironic, right? Because if I spent the time figuring out how to set up, I have no agents. I have 0 agents running my life right now. I have prompts that are saved in a note, and that is like as far as I've gone. But yes, that's probably a perk of working at an AI company.
We can do a session on it later.
Yes, please. I will come to the Nate Griss boot camp. What is something you believed about AI in healthcare a year ago that you've changed your mind on?
So I think I was always pretty bottom up in terms of product-led growth. I still believe very much in product-led growth. I also think now that I've seen it work really well, there are opportunities for leadership to lead from the front with AI at a lot of our partners. Like historically with tech, it was almost adversarial. It's your boss forcing you to use your EHR or things like that. But when we do retrospectives on our most successful deployments, it almost always correlates with things like how many training sessions did you do with their C-suite? How often do you get the chance to help them show their teams how they're using AI as something that then enables that bottom up? And it was great to get more time, I think, with that sort of rollout experience here and the potential that it really has.
Yeah. What's the biggest mistake founders are making building AI healthcare companies today?
There's probably a lot of patterns to all of the previous generation of tech that you and I spent our time on supporting founders. It's don't do the hammer looking for a nail. Don't take AI and duct tape that to
Yeah.
healthcare. I think that's just a general rule.
Rule number one in massively better healthcare. Yeah.
Yeah.
So same problems, just like new technology, but founders are making the same mistakes in terms of like falling in love with the solution and not the problem.
New shiny objects.
Yeah. Well, investors are eating it up. So what is the hardest problem in healthcare that AI probably won't solve anytime soon?
Probably the incentives. It's it's easy to chip away at high volume workflows. Like there's an order of operations that we have to really respect with trust and governance and the hookups and everything. But as much as you do to reduce friction and improve access and make your expertise go further, like it doesn't fix who pays, it doesn't fix who's accountable, it doesn't fix who gets rewarded for doing the right thing or the wrong thing. It may indirectly lead to some revolutions there, but I think we need to continue to have national conversations around incentive alignment.
Yep. All right, Nate, to close things out, and I'll let you answer this with a longer answer because you will need it. But you and I have been at this for 15 years. What does healthcare look like in another 15 years when I have you back on the show? Give me like your best case scenario.
Ooh, 15 years is a really long time for tech that has only been out for 3. So what will have changed? I mean, it's very hard for any of us to predict these exponential curves, but something I can point to that I think we never fully appreciate is people who grew up with AI are going to relate to these tools really differently. I remember made a chart recently for a grand rounds where I took like a discipline like math or biology or computer science, whatever. And when AI hit the elementary level, the high school level, the PhD level, et cetera. And usually when people make those charts, they trend line it, right? And they say, when is AI going to be a superhuman and solve everything for us? But I think if you pull the trend line the other direction, and you can basically ask the question, when will kids be born when they grow up with models that essentially are always smarter than them at a particular domain? And I don't mean that in a crass way. Of course, every kid is a beautiful snowflake, and like we grew up with calculators, we still did fine. But it's very different, from your level of comfort from like how you might approach AI as a front door or as a tutor than for folks like you and me who kind of have to convince ourselves of all of the different hoops that we have to jump through. And so I think we need to be really attentive and respectful and put a lot of attention on that. I think the other thing that'll happen is we're going to start to see a lot more loops. And whether those loops are completely closed or still have humans in them, that's just going to be technically obvious with time. Right now, you can see the effect of these loops in coding. You can see it, I used to have to supervise every line of code that I wrote, and 19 out of 20 would need some work. And now you can just let the coding agents run for 8 hours, 12 hours, and the loops all work. And like, what does that mean when that's applied to other areas, and what kind of abundance does that create?
What does that mean? What does that mean for our healthcare?
I mean, I think certain things are going to be less about can we technically do this or can we technically do this for everyone? It doesn't mean that all problems are solved. It like increasingly means that the early amount of work has to be who takes on actuarial risk, regulatory risk, liability risk, those sorts of things. Or how do we
Those
make
seem
sure that
easier problems to solve than like actually building the technology.
yeah, yeah. And then finally, I think, we're still going to have the fax machine probably. I
No.
hate I hate to say it. I hate to say it, but what if AI like helps it survive, right? Because it remains that last universally adopted protocol and you no longer need structured data. So I'd love to see every fax machine gone, but I bet there'll be a holdout
Yeah.
somewhere. Set a
Yeah.
calendar appointment to check.
Yeah. Do you think AI prescribing will be ubiquitous?
Ubiquitous is a tough phrase because there's a whole graduated set of but I think where we see interesting sandboxes right now are around things like refills. And, there are certainly some medicines where I think of the ones that I'm on and now I bother that poor physician at One Medical every 90 days to get a refill. And they've been doing that for 8 years. Like there are things like that that will probably be solved. And there'll be other things like chemo where AI may play a tremendous role in personalizing and optimizing, but also like that is a very human experience.
Yeah. Awesome. Well, Nate, thank you so much for your time today. It was great seeing you and chatting with you.
Likewise, Hallie.